Hey everyone, welcome back. Sometimes you're just like exploring your own mouth, right? With your tongue. You're like, wait, is that a bone in there? Have you ever felt that? That little bump inside your lower jaw?
Yeah.
Well, if you have, you might be familiar with today's topic.
Yeah.
Mandibular Tori.
Mandibular Tori. And you are not alone, by the way.
Really?
It's amazing how many people actually have these little bony growths,
Yeah.
and they just don't even realize it.
Interesting.
Yeah, it's not until, like, they go to the dentist, and the dentist is like, oh, by the way, you have just got a little something extra going on in there.
It's like finding like a secret room in your house,
Yeah.
You're like, oh, that's a little
Exactly.
be alarming, but also kind of cool. So, to kick things off, can you give us a proper introduction to mandibular tori?
Sure.
What are we even talking about when we say that?
So mandibular tori are basically just these extra bits of bone
Okay.
that grow on the inside of your lower jaw.
Gotcha.
Usually like kind of near your premolars, like those back teeth.
Okay.
And the important thing to remember is that they're benign,
Okay.
which just means that they're not cancerous or harmful in any way.
Okay, so nothing to freak out about then.
Exactly. Yeah.
But this is different than having like a bump on the roof of your mouth, right?
You're right. Those are different. Those are called torus palatinus.
Torus palatinus, okay.
Yeah. And they're way more common.
Interesting.
Like 20% of people have torus palatinus.
Wow, so it's a lot.
Yeah. Mandibular tories are less prevalent, only about 1 in 25 people.
Huh, interesting.
Yeah.
So it's like a select club.
Right.
Not that I'm in it or anything.
Right.
But what causes these things in the first place?
Right.
Is it something we're doing?
Yeah.
Or is it just like luck of the draw?
That's where things get really interesting.
Okay.
So genetics seem to play a huge role here.
Okay.
Studies with identical twins show like a 94% chance
That's really.
that if one twin has a mandibular tori, the other will too.
Wow. 94%.
Yeah, it's a huge genetic component.
So if my twin's rocking the jaw bump, chances are I am too.
You probably are, yeah.
That's wild.
It is really interesting. And it goes beyond twins too.
Okay.
Certain populations like the Inuit, Norwegian, Thai, some indigenous American groups, they have a much higher prevalence of mandibular tori, which suggests that there's some genetic predisposition there.
Interesting. So those late night ancestry deep dives might reveal more than just your great-great-grandmother's love for polka music. Maybe a little
Totally. Exactly.
jaw bump action going on.
You never know what you're going to find.
Exactly. But genetics can't be the whole story, right?
You're right.
What about like environmental factors?
That's a great point, and you're on the right track there.
Okay.
While genes definitely lay the foundation,
Yeah.
there are other things that can influence whether you develop tori or how large they get.
Okay.
One thing that's been looked at is teeth grinding,
Interesting.
also known as bruxism.
Bruxism, yeah.
Thought to be a potential culprit.
Oh, interesting. My dentist actually did mention that I clench my jaw when I'm stressed. And I also might have a little more bone than the average person. Maybe there's a connection there.
It's definitely possible, yeah. And more research is needed, for sure.
Okay.
But there are studies that have found links between mandibular tori and, things like higher calcium intake,
Interesting.
eating a lot of fish, or even certain chewing habits.
Wait, are you saying that my childhood love of chewing on those calcium chews is coming back to haunt me?
Well,
In the form of extra bone?
it's not quite as simple as that.
Yeah.
It's really most likely a complex interplay of
Yeah.
all these different factors.
Right.
And some studies even suggest that vitamin deficiencies could be involved in some cases.
Wow. This is actually way more interesting than I even imagined.
Yeah.
I'm starting to think of these bony bumps as like a little window into my own personal history now.
Right. Exactly.
But on a more practical note, should people actually be concerned about this?
Okay.
Are mandibular tori ever actually a problem?
So the good news is that for the vast majority of people, mandibular tori are totally harmless.
Okay.
And they're nothing to worry about. They're usually painless and they don't cause any functional issues.
Okay.
A lot of people live their whole lives without even knowing that they have them.
Okay. That's reassuring to hear.
Yeah.
But I'm guessing there are some exceptions to that rule.
Sure.
When would mandibular tori actually require a trip to the dentist?
Yeah, so while they're generally harmless, there are a few situations where they might need a dentist's attention. One is if they interfere with things like getting dentures fitted properly.
That makes sense. Trying to fit something over a bony bump just sounds uncomfortable.
Exactly. And in some cases, if the tories grow large enough,
Yeah.
they can actually cause problems with eating, speaking, or even just maintaining good oral hygiene.
So if my natural has ever become like a contender for most prominent feature in my mouth, should I get that checked out?
Yeah, I think that's a good idea.
Okay, are there any other red flags to look out for?
Absolutely.
Uh,
So if you notice any changes in the size, shape, or color of your mandibular tori,
Okay.
or if they start to cause you any pain or discomfort,
Yeah,
definitely see a dentist or an oral surgeon just to rule out anything serious.
got it. So let's say, hypothetically, my mandibular tori have decided to really overachieve. They're causing issues. What can be done about it?
Okay.
Is surgery the only option?
So before we jump to surgery,
Yes.
it's important to remember that most people with mandibular tori never actually need treatment.
Right.
However, if they're causing you significant discomfort,
Oops.
interfering with dental appliances, or impacting your oral health,
Yeah.
then surgical removal might be something to consider.
Okay, so I will admit the word surgery always makes me a little nervous.
Right.
What can someone actually expect if they need to have this procedure done?
Sure. So if you do need surgery, it's usually a pretty straightforward procedure.
Okay.
It's done on an outpatient basis, so
Yeah.
you don't have to stay overnight in the hospital or anything like that.
That's good?
They'll numb the area with a local anesthetic. And then in some cases, they might offer you sedation as well,
Okay.
which can just help you relax during the procedure.
That makes sense.
Yeah.
Okay, so that honestly doesn't sound too bad.
Yeah.
So once you're all nice and relaxed, what actually happens?
Right. So the oral surgeon will make a small incision in your gum tissue
Okay.
just to access the torties and then carefully remove that bony growth
Okay.
using some specialized instruments.
Yeah.
And then sometimes they might need to do a little bit of smoothing out
Okay.
of the surrounding jawbone just for a more comfortable result.
Makes sense.
And in some cases, they might even use a small piece of bone called a graft
Oh, wow.
taken from either elsewhere in your mouth or somewhere else in your body.
Okay.
And that can help the area heal more smoothly.
And then what? Do they just slap a bandage on it and send you on your merry way?
Yeah,
So it's
yeah.
not exactly like a walk-in, walk-out situation? Then,
Not quite, no.
Yeah.
A little more involved than that.
okay.
So yeah, depending on how extensive the procedure is, you might have some stitches.
Okay.
And you'll definitely get some instructions on pain management, oral hygiene, just what to expect during the healing process.
Okay, so I'm guessing, like, chewing gum is probably off the menu for a while.
Yeah, probably not the best idea.
What about just solid foods in general?
You'll probably have to stick to a soft food diet
Right.
for a little while just while things heal, but your surgeon will give you all the specifics.
Okay, good to know. So let's say, hypothetically, we've dodged the whole mandibular tori situation. No extra bumps for me, thank you
Oh,
very
right.
much. But what about prevention?
Right.
Is there anything we can do to avoid developing these things in the first place?
So, unfortunately, there's no, magic bullet to completely prevent them,
Okay.
just because genetics play such a big role. But
Right.
the good news is there are definitely things you can do to potentially minimize those risk factors.
Okay, now you're speaking my language. Lay those preventative tips on me.
Okay, so if you're prone to teeth grinding, like we talked about,
Right.
managing that is going to be key.
Okay.
Talking to your dentist about a custom-fitted mouth guard to wear at night,
Yeah.
that's a great place to start.
I've heard those mouth guards can be really life-changing,
Yeah.
even beyond the whole tori thing, like less jaw pain, fewer headaches. I'm like, sign me up.
Exactly.
Are there different types of mouth guards, though? Or is it just kind of like a one-size-fits-all?
There are different types, actually, depending on, how severe your grinding is.
Okay.
Some of them are softer for more mild cases, and then some of them are really heavy duty
Okay.
if you're like a champion clincher.
Right.
So your dentist can help you figure out which one is right for you.
Makes sense. So, mouth guards for the win. What about those dietary factors that we were talking about before? Any tips for keeping those in check?
Yeah, I mean, the research on diet is still kind of, it's ongoing,
Right.
but it's never a bad idea to just focus on a balanced diet overall.
Right.
Make sure you're not deficient in any key vitamins or minerals.
Okay.
And if you're concerned about that, your doctor can run some tests and check for those things.
That makes sense. So, basically, eat your veggies, take your vitamins, maybe lay off the super chewy jerky.
There you go.
All right.
It's a good plan.
Perfect. And then I'm assuming good oral hygiene is probably never going to hurt either.
It's never going to hurt. That's right.
Okay.
Regular brushing, flossing, and those dental checkups are going to go a long way in just keeping your mouth healthy overall.
Right.
And, that way your dentist can also monitor for any changes, including those tories.
This has been incredibly eye-opening. I feel like I could give a whole presentation on mandibular tori now. Who knew that these little bumps could be so fascinating?
Right.
But if there's one big takeaway that I really want our listeners to walk away with today, it's that don't panic if you discover that you have mandibular tori.
Exactly.
They're incredibly common.
Right.
Usually totally harmless.
Yeah.
And often they don't even require any treatment at all.
That's right.
And if they do start acting up for some reason, obviously, don't hesitate to go and talk to your dentist.
Exactly. Exactly. Knowledge is power.
Right.
And you've got the knowledge now.
That's right. You can decode the little mysteries inside your mouth.
There you go.
It's funny. We started this conversation talking about mandibular tori, like there were these weird, like, hidden things.
Yeah.
But I feel like the real discovery here is not the tori themselves.
Right.
It's like the science behind it.
It's so interesting, right?
It's super interesting. It's like these little unexpected things can actually be these, like, really fascinating rabbit holes to go down.
Totally. And it kind of makes you think.
It does.
What else is hiding in plain sight?
Right. Exactly. Like, what else are we walking around with every day?
Right.
That we're, like, totally unaware of?
Exactly.
That could be just as cool.
Yeah.
So, I guess the takeaway there is next time you're brushing your teeth, take a moment,
Appreciate it.
Appreciate those mandibular tori.
Right.
Or lack thereof, as the case may be.
That's right.
It's just a testament to, like, how amazing and complex our bodies really are.
The human body is amazing.
It really is.
Just this incredible interplay of, genetics and environment.
Absolutely.
And just all the things that make us unique.
Well, on that note, we'll leave you to ponder those mysteries.
There you go.
Thanks for joining us on this deep dive into the world of mandibular tori.
Yeah, thanks, everyone.
Who knew that a little bump could be so captivating, right?
Until next time.
See you later.